Happy Thursday, everyone. Thank you for being with us today. I am honored to be joined by my colleagues, Commerce Secretary Stephen Pryor and the one and only Major General Chris Callahan from the Rhode Island National Guard. Both of these gentlemen are truly valued colleagues who have been working through this pandemic with me and the team since day one, and I'm honored to continue having their support and presence with us here today. So I'm happy to stand before you today and report that Rhode Island continues to be in a very good place when it comes to our overall COVID-19 response. And it's important for us to take a breath together and really look at the full landscape of the situation that we have before us. Over the last 24 hours, we have made more than 10,000 appointments to get people vaccinated at 2 new centralized mass vaccination sites in Rhode Island. We have effective treatment for COVID-19 getting administered throughout the state every day. We are still leading the nation in testing, and the data situation, as you can see right now on the screen, and we'll dig into a little bit more, is better than it has been in months. So testing, treatment, and vaccination, it's our comprehensive package. We've talked about those being the tools that bring us through the final components of this response. And look at our data. This is a key component. This week, our statewide percent positivity decreased again, this time from 2.8% to 2.2%. The number of cases in every city and town in Rhode Island was below 300 cases per 100,000 people last week. And we saw a decline in case counts and percent positivity for all age groups during this time. Specific to yesterday, we had 320 new positive cases out of 17,924 tests for a percent positivity of 1.8%. For context, before we got our pause in place around the holidays at the end of last year, this percent positivity number was close to 10%, and it is now 1.8%. That is critical. Similarly, our number of current hospitalizations is 180, down from around 500 people hospitalized on days in December. And our daily hospital admissions are down 46% since just last month. These kinds of results are not by chance. When we look at the full picture of where we are in Rhode Island, we have to acknowledge that they are directly attributed to some of the very targeted and strategic decisions we have made as a state over the last 2 months. And they are directly attributable to the patience, the partnership, and the sacrifices made by people such as yourselves throughout Rhode Island. Again, the patience, the partnership, and the sacrifices. So I want to thank you. It does pay off in that bigger picture. Our overall goal is to steer this so that we get to have a great summer together here in Rhode Island. We are positioning ourselves very strong for being able to do that. During our last 2 press conferences, Secretary Pryor announced some incremental changes we were able to make in response to our data trends. If you recall, he announced some changes for bar areas in restaurants and for houses of worship and venues of assembly. Today, in continuing that, I am very pleased to be able to announce some updates to restrictions that have been in place for visitation in hospitals and long-term care facilities. Today, we will start with hospitals. You may remember that in March of 2020, we released hospital visitation guidance in response to COVID-19. And you may remember that this guidance used a 3-level approach to visitation. Effective tomorrow, we are allowing hospitals to return to level 1, which is the least restrictive level. The hospitals will still be asking you to work with them to minimize the potential spread of infection and ensure the safest environment for patients, staff, and visitors. All hospital staff, patients, and visitors must continue to practice the 3 W's: washing their hands, watching your distance, and wearing your masks, the most effective masks we have. Hospital visitors will also have to be screened for signs and symptoms of COVID-19 upon entry, and we have provided hospitals with guidance on other measures they must take to ensure that visitation is happening safely. However, while hospital visitation today is largely limited to support people and family members during end-of-life situations, I am so thankful to say that that will not be the case tomorrow, based on what I was just able to share. To be clear, visitation is not just going back to normal, because we have to still take significant precautions like mask wearing and continuing to get screened upon entering, but it will feel a little more like it did before these higher level restrictions went into place. I want to caution that it is still important for you to work with your loved one's providers. If you are sick or becoming sick, it is still best to forego making visits to vulnerable ones in the hospital. To keep everyone safe, we will still need to be cautious and rely on the clinical judgment of your clinicians, physicians, nurses, and the staff who are caring for your loved ones. Similarly, for nursing homes and assisted living facilities, we are very happy to announce that effective tomorrow, visitation should resume if the facility has not had any COVID-19 cases in the last 14 days. If a facility identifies one case, the facility should adhere to the quarantine and isolation guidance currently in place. If a facility identifies 2 or more cases, they should contact the Rhode Island Department of Health. At that time, our team will consult with the facility on next steps when it comes to visitation. We have issued updated guidance to long-term care facilities with additional details, including guidance on how to make sure that ventilation is as good as possible, and to continue to follow the rules on mask wearing and screening and hand washing. Restricting visitation was a very important measure to protect vulnerable Rhode Islanders and our healthcare system. It was done to protect the people we love, but without a doubt, it was one of the most difficult, heartbreaking choices we have had to make in the last year. I want to take a moment to really acknowledge the stress, the sacrifice, and the pain that limited visitation has caused to patients, residents, families, and the staff caring for the patients. We know that this has not been easy, and we truly thank you. I also want to thank all of those staff at these facilities who have made tremendous sacrifices. We are extremely grateful, and we're pleased that our data is in such a component of this response now that we're able to move forward with opening visitations. I'm also grateful that we have a nation-leading testing program here in Rhode Island. If you are going to be visiting your loved ones in hospitals or nursing facilities, you should commit to getting tested once a week. The capacity is there for you. We are encouraging that to happen. It's easy. We have test site access across the state, and many of them provide test results within 15 minutes. Importantly, with a new strain of COVID-19 identified in Rhode Island, The best way to protect your household is to get tested regularly, wear a high-quality mask, and continue to follow the guidelines that we are issuing. Over the next 2 weeks, we will be distributing more than 400,000 KN95 masks across the state. Even if you don't have symptoms, go get a test and get a mask. Doing these two things can help you protect your household. We'll be giving out those masks at the testing sites across the state so that you can get your test and get your mask at the same time.